everyone, welcome to my channel, and hello if you are new here. My name is Summer and I am 40 years old and currently 32 weeks pregnant with a little baby boy. This is going to be a video about 5 pregnancy symptoms that are not glamorous by any way, shape, or form, but I'm going to talk to you about them, and I'm also going to talk to you about them and let you know what are some things that you can do to help alleviate these embarrassing or not so glamorous symptoms of pregnancy. I feel like a lot of people focus on the glow of pregnancy, and while that's true for many women, some women it's not, because you're dealing with a variety of different symptoms. Because if we think about it, you have to realize you are growing a 6 to 8 pound, sometimes bigger than that, baby, and that baby has to go somewhere, and your entire body shifts. Your hormones shift, your body, your intestines, all the organs within you shift. So it's normal to expect that there will be some symptoms that might be a little bit uncomfortable to talk about, but this is my 8th pregnancy, 6th baby, so I'm definitely well versed in all different types of symptoms that I've experienced, and none of them have been so horrible that obviously I wouldn't be willing to get pregnant again. I can say at the end of pregnancy, they've all been worth it. Maybe not so enjoyable, but we'll talk about that, and let's get started. So the first pregnancy symptom that I've been dealing with throughout this pregnancy and through my previous pregnancies as well, that I battle with pretty much the entire time, has been constipation. And when you're thinking about it, it starts when you first get pregnant, because progesterone slows down your body's digestive system and everything. And you got to think that in a way that's actually beneficial for the baby, because the slowing down of your digestive system allows your baby to absorb more of the nutrients from your food than typical, because the baby is like a sponge soaking up all the nutrients that you're eating and taking in. So constipation is definitely one, to the point that I know whenever I get pregnant, I need to make sure I start extra fiber, be cognizant of my fiber intake, and go above and beyond. And so at the beginning of the pregnancy, I was taking Citracil, and I was also taking Colace, because although Citracil is a fiber capsule that helps me get things going, Colace also helps soften things so they don't hurt coming out, because I was also experiencing the other problem where I would be bleeding from the hemorrhoids that would happen, and it would just be painful. During the 2nd trimester, that kind of subsided. That was a pretty good routine. But then what ended up happening in the 3rd trimester, as baby has now completely shifted all of my internal organs, because I got an ultrasound done today and he is 4 pounds 8 ounces estimated, and in the 62nd percentile. My organs have to go somewhere, and they're not in their usual spot, and my digestive system has slowed down, and so the bleeding has kicked back up again. But I know it's from the other end, not the end that threatens baby. So I'm staying on top of my fiber, being very aware of the foods that I'm eating, as well as making sure I continue with the Colace. The Colace will also help post-delivery, because it's very traumatic, that first bowel movement that you have after delivery, because it can be painful. And I mean, when you've just had for me, in my case, a 6 to 7 pound baby, and then you're sore down there and everything, that is one thing that I highly recommend, to stay on top of, because it can be painful down there, and a lot of people don't necessarily like to talk about that. The next symptom that I want to talk about is, I noticed, and you might notice too, if you look at some of my earlier videos before I got pregnant to now, I'm swallowing more. And that is because when I'm pregnant, my body produces extra spit. And what I found out about that is that with your hormones changing, it does something to your mucous membranes so that you produce extra spit. And I'm going to get into another symptom a little bit later, but as a side effect of what the hormones do to your mucous membranes, that is just another not so enjoyable thing. So chewing gum sometimes helps, but staying hydrated, all of that. But I did have to get used to just swallowing more and pausing more. And, you know, it's uncomfortable because you notice it, but I don't know how much other people notice it. I mean, if you notice it, and I mean, it just comes along with it. So if you're pregnant and you're like, why am I swallowing more? Why do I have to pause more? Just you feel like there's more spit in your mouth. That's unfortunately another side effect. It can make you a little bit self-conscious, but for the most part, most nice, kind, general people are not going to notice it. And the ones that do notice it and want to criticize you for it aren't the ones that you want to be paying attention to anyway, especially when you're busy trying to grow a new life. So this next symptom is one that I did not notice until I was pregnant in a higher elevation. So I've been pregnant in the state of Hawaii, and I've also been pregnant in Virginia, and now I'm in a high desert, high elevation climate. And when I was pregnant in Hawaii and Virginia, where I was at sea level and there's lots of humidity, I did not have this problem. So I'm thinking this might be a symptom if you live in a drier climate or a higher elevation. And if you are in one of those climates, please let me know if you've experienced this too. But around the second trimester, I start feeling like my ears are congested, and it affects my hearing. It's very uncomfortable, and I start feeling like, oh my God, is this what it's like when you get older and you are losing your hearing? I mean, because it's tough, because I'm like talking to my kids, and they're talking to me at a normal level, and I'm like, please understand, I can't hear out of my left ear because it affects my left ear. Not so much my right ear, but I think it goes to the mucous membranes, thickening up the mucus in your body, and it affects your sinuses and all sorts of other fluids within your body. In fact, I think that's what a lot of the hormones do, is they do things to the fluids in your body, because you have to increase your blood volume and everything when you're pregnant. So that is one symptom that, in order for me to deal with it, so I don't feel like I'm constantly losing my hearing, is I use a neti pot to rinse out my sinuses. And that's really helped. It's helped me from getting horribly sick when I had COVID. And it's also helped me with any common colds to get over them quicker. But even if I feel like I can breathe and all is well, doing the neti pot once a day, every other day, that is the one time that I'm like, oh my God, I can hear now. And that's because my sinuses and, over here, it's not congested anymore. I've even had an x-ray done with this pregnancy because I thought I might have needed to do a root canal. And it actually turned out that I was just having some sinus pain and some cloudiness in my sinuses, particularly on the side that I've been struggling with. So I have faith that once baby boy arrives, that everything will go back to normal. It may take a little bit of time, but I'll be able to hear on a regular basis, normal basis again. Since we're on the topic of fluids, the next symptom that is definitely not glamorous, but it's just a side effect of pregnancy, and it's something that we pregnant women deal with, whether we deal with it silently or not. I'm here to tell you there is so much fluid and discharge. Nothing abnormal, like that would make me think that there's an infection going on, but it's to a point that on a regular basis, I wear a panty liner just to make sure that things stay dry down there. It doesn't feel good to me. So haven't found a way to avoid it. And I figure once baby boy arrives, everything will go back to normal. But I've gotten panty liners in bulk from Costco that I just wear every day. And it makes it so much better so that I'm not changing my underwear like 3 times a day. But again, another thing, just be prepared if that happens. I don't know if other pregnant women experience that, but I know that's been a problem for me. Wearing panty liners on a regular basis, that's something that I deal with. But it's all worth it in the end because we think about everything that we're going through and what we're doing it for, and it's for our little one. This last symptom, I'm pretty sure every pregnant woman has dealt with, having to pee constantly. That is definitely a symptom that I do not enjoy waking up 2-3 times a night in the middle of the night, whether I'm in my first trimester or my third trimester. But in the third trimester, where baby is heavy and pushing down on your bladder, I cannot fully empty my bladder. And it takes me a lot longer to pee now because I would sit on the toilet and kind of shift the baby around trying to and it's almost like, imagine when, I don't know if you've ever done this, but if you somehow, when you're opening up a wine bottle and the cork goes in the wine bottle and then you're trying to pour the wine out or trying to salvage the situation and then the cork just kind of keeps blocking the wine from getting out. I kind of feel that way about my bladder right now because I'll sit there, go to the bathroom, get up, and because I changed position and baby boy changed position, then I got to go right back to the bathroom. But while you're pregnant, don't be surprised if you go through a roll of toilet paper a lot quicker. And so those are my 5 not so glamorous, sometimes downright embarrassing pregnancy symptoms that, you know what, in the end, I would be shocked if most pregnant women didn't have at least one of these symptoms. In fact, the constantly going to the bathroom one, I'm pretty sure most women have. But it's just these other ones that sometimes when people are talking about the glow of pregnancy and gosh, sometimes you don't feel like you're glowing. I know that I'm 30 pounds heavier than I was when I got pregnant, and I feel bloated and uncomfortable, and I don't want skin-tight clothes on me because I feel like I'm restricted, and even moving around sometimes is uncomfortable and dealing with the hip pain and all that other stuff. It's not going to be all glamorous, and growing a life is such a beautiful thing, and it's all worth it in the end. But just be prepared for some of these things. If you're dealing with some of these pregnancy symptoms, please know you're not alone. I've been dealing with them, and it'll get better. And if you are experiencing some of these, please let me know in the comments down below, or if you want to share some of the symptoms that you've been having that have not been so glamorous so other pregnant women don't feel so alone in these, because I don't think this gets talked about enough. Please comment down below. So please like this video if you did, and subscribe for future updates. And until next time, bye guys.